Okay, hiatal hernia is something you may not see very often during your career as a nurse. You may have patients who have a history of hiatal hernia, or you may have patients that kind of have symptoms of hiatal hernia. Let's talk about what it is really briefly. So for hiatal hernia, what we're dealing with here is our diaphragm becomes weak. The muscles of the diaphragm become weak. And what that does, that allows portion of the bowel and stomach to protrude up into the thorax, okay? So here's our thorax, our lungs would be up here, our heart would be up here. And what's happening here is as these muscles weaken between the thorax and the abdomen within the diaphragm, that allows this portion of the bowel to move up, okay? So as we think about that, let's think about some of the symptoms and some of the treatments that we can do for these patients. Again, very briefly, this is a protrusion of bowel through the diaphragm into the thorax, and it's due to weakening of the muscles in the diaphragm. So one last time, here would be our diaphragm, and as these muscles weaken here, this allows for the bowel and the stomach to protrude back up into the diaphragm. Okay, so lungs would be up here and heart. And as that protrudes up in there, this is where we start to have our problems, okay? So some of the symptoms we're going to have are going to be very similar to like GERD. We're going to have heartburn, regurgitation, dysphagia, fullness, and bowel sounds over the chest. So let's focus on bowel sounds over the chest. So as our patient is lying, let's say here's our patient. Okay. So here would be our diaphragm on our patient. Now what we're going to do is we do our listening, right? We're going to listen to the heart. We're going to listen to the lungs. And as we start to listen to our lungs near the diaphragm, we may start to hear bowel sounds, okay? And as we hear those bowel sounds, that's a good way for us to distinguish whether this is, in fact, GERD with the symptoms that they're presenting with, or whether this is actually possibly a hiatal hernia. Now to confirm, we can do x-rays and things to determine that there actually is this protrusion. But listening to those bowel sounds over the chest, obviously that shouldn't be there. You know, our bowel sounds need to be a little bit lower in our left upper abdominal quadrant. And so if we're hearing them over the chest in the thorax area above the diaphragm, that's telling us, well, you know, if that gurgling, everything's going on up there, this is clearly not normal, and that would be a sign of a hiatal hernia. So therapeutic management, again, is going to be very similar to GERD. We want our patients to refrain from lying down after eating, and that's going to allow for gastric emptying. We're going to also avoid medications that delay gastric emptying, medications like anticholinergics. Anticholinergics are going to be part of our fight or flight system, which are going to prevent gastric emptying, okay? So basically what we're going to do here, or what these medications are going to do is, remember, they're going to be part of that fight or flight. They're going to delay gastric emptying, they're going to cause bronchodilation, increase the heart rate and things like that. And so by doing that, what that also does, it prevents the stomach from being able to empty. So we want to try to avoid those types of medications in these patients if possible. We want them to eat small and frequent meals, avoid straining, avoid vigorous exercise if possible, and they need to sleep with the head of the bed elevated, okay? This helps to prevent, so here would be their stomach protruding up into their diaphragm. So this is going to prevent that gastric content from flowing up into the thorax and causing bigger problems, okay? So that's kind of how we're going to manage this. It's kind of what's going to happen here. Is we're going to try to allow for gastric emptying. We're going to try to keep the patient upright, prevent any conditions that's going to further cause food and bile to flow up into the chest, okay? So that's hiatal hernia, and that's how we're going to manage it. If you have any questions, please let me know.